Hello everyone, today we'll be doing a junk journal all about cleidocranial dysplasia. Cleidocranial dysplasia is also known as CCD, which is how I'll be referring to it for the duration of this video. The etiology and life cycle of CCD is it is a very rare disease. It happens in about 1 in a million births. It happens equally in men and women. There is no predilection of genre or ethnic group. Half the cases are caused by spontaneous mutation and the other half is from inheritance. It is autosomal dominant. The gene for this syndrome has been mapped to chromosome 6, region 21, and patients born with this disease have it for the duration of their life. As you can see, there are many historical significances of CCD that I have listed. The top 3 that I'm going to go over with you today starts in 1760. Dr. Meckel wrote the earliest recognizable report of CCD in medical literature. In 1898, Dr. Marie and Dr. Santon formally named the disorder cleidocranial dystosis, also known as Marie-Stanton syndrome, also known as cleidocranial dysplasia, also known as CCD. And by the millennium, not only have over 1,000 cases of CCD have been reported, but it was also discovered that the chromosome 6 region 21 was the determinant gene in CCD. This chromosome involves the control of osteoblastic differentiation and chondrocyte mutation during endochondral ossification. The effect of CCD on an individual varies per patient. Some have debilitating effects, some have less severe to mild and manageable issues. CCD affects bones in their development. The bones may be formed abnormally and may be completely absent. People with CCD have a normal life expectancy, and with proper anticipatory guidance, people with CCD usually lead healthy and productive lives. The effect of CCD for dental hygiene treatment has many different dental considerations. Patients will likely require multiple surgeries to manage the oral and maxillofacial issues associated with this syndrome. Utilizing a pedodontist, orthodontist, oral surgeon, and prosthodontist is recommended for patients with CCD. When treating a patient with CCD, dental hygienists should be aware of the following conditions and possible ways to help prevent gum disease and caries. Infants with CCD should receive their first dental evaluation by 1 year of age. There is a delay in tooth eruption and exfoliation. The times vary per patient and sometimes may not happen at all. Impacted adult teeth may form cysts, causing them to be encased in bone, making them unable to erupt without intervention. Supernumerary teeth are common and may require removal. A cleft palate or a high-arched palate is likely, but the cleft palate is typically treated shortly after birth. The patient may have malocclusion, an underbite or open bite, a prognathic mandible, and the enamel on the teeth may be thin, making the teeth more prone to caries. Fluoride treatment and suggestions of fluoride products is vital. Crowded teeth may hinder the patient's ability to properly clean the area, so teaching the patient proper techniques for at-home care is essential. By being aware of these conditions, how they affect the patient's dental hygiene treatment, and providing patients with tailored oral hygiene instructions will reduce the negative effect CCD could have on the patient's oral health. There are many signs and symptoms of CCD and they vary per patient. The signs and symptoms are related to bone growth and development. Some examples include premature closing of the soft spot on the head and delayed closure of the sutures of the skull. There may be narrow and abnormally shaped pelvic and pubic bones and deformations on the thoracic region. The face presents with a wide, flat, or protruding forehead, sometimes with a vertical groove down the center due to the delayed or lack of closure of the frontanelles, a low, wide nasal bridge, wide-set eyes, and a small midface and lower jaw. The palate may be high-arched or cleft. The sinuses are small or absent. Ear infections and sometimes hearing loss is common. Patients are typically short in stature with a narrow chest, sloping shoulders, and incompletely formed or missing clavicles. This allows their shoulders to be brought close together and even touch. Short fingers, extra or missing ribs, a curvature of the spine known as scoliosis, knock knees, which are knees that bend inward towards the center of the body, osteopenia or the loss of bone mass, and sleep apnea are all symptoms. Treatment for CCD depends on how this syndrome affects the patient. People with CCD may undergo multiple orthopedic, facial reconstructive, and dental procedures to improve their comfort, function, and well-being. Recommended treatments might include facial reconstructive surgery on the bones of their face to reshape the forehead or their cheekbones, spinal fusion procedures to support the spinal column, lower leg surgery to correct knock knees, surgical repair of fractures due to fragile bones, removal of small collarbone pieces that can affect the brachial plexus and cause arm pain or nerve problems, ear tubes to treat ear infections, a protective helmet to protect the open areas of the skull, calcium and vitamin D supplements to strengthen bones, removal of supernumerary, primary, or impacted permanent teeth, orthodontic traction of impacted permanent teeth, or removal of overlying bone of the permanent teeth to facilitate their eruption. Fun fact, Gaten Matarazzo, Dustin from Stranger Things, he has CCD, and through his platform, he has been able to spread the awareness of this 1 in a million disease. Alright everyone, well that is it for today. I hope you enjoyed my little journal all about cleidocranial dysplasia. Thank you.